Hi everyone, this is Sean with the MassSupport Network here with the Massachusetts Public Health Report for Friday, December 4th, 2020. So we're still in the throes of the wobbly Thanksgiving numbers. There'll be some stuff we'll do less of and some we'll do more of because it's been a 2-week break since we last had an update like this. So first of all, 2 weeks ago, there were estimated to be just under 35,000 active cases in the Commonwealth. This week, they're estimated to be just under 50,000. It's a big jump there, but as we'll see, there is still perhaps some not quite as many as we might expect. So we may be seeing some sharp rises in the next couple of days. So this is where things stood last time we checked in terms of quarantines with 8,000 people under quarantine. And here's how things have risen in the last 2 weeks. Here's where we were the day after Thanksgiving. And here's where we are this week. Now, this is actually kind of troubling that it hasn't gone up more because this signals that maybe we are not getting enough people contact traced, enough people I think because there's certainly been probably plenty of exposures in the last week. If this stays constant next week, well, then maybe actually people did not travel as much in Massachusetts for Thanksgiving as we might have thought. But we'll see. This might just suddenly spike next week as well as kind of the apparatus kicks back up from the holiday. Now looking at confirmed cases and seeing how this works with the holiday. So we had 33,000 and change in isolation. Then after Thanksgiving, we had 41. And this week we have 45. So that's almost what I'd call a disturbingly small increase, which makes sure that just not enough people, enough tests have gone through in the last week. And this is that still holiday backlog that we've been talking about. Now, moving forward and looking at where the pandemic is in terms of demographics, still the largest age group for new infections. This is just looking at the left side is the new infections by age group as of 2 weeks ago. And on the right, this is where it is today. And still the 20 to 29 demographic is still catching the most of these, but there has been a big kind of uptick there in the 30 through 39 as well. I mean, everything has increased, of course. We've not seen any time when it's gone down recently. And looking at this as a function of the pandemic as a whole, with this chart showing the age brackets with the youngest on the bottom. So we have, generally speaking, things are more or less holding steady with a couple upticks in some of the older age brackets here. There might be some slight downturns in the younger brackets as a percentage of the whole due to reduced college testing, as some colleges may have sent people home for Thanksgiving and not have done any testing in the last week. So that remains to be seen there. In terms of getting infected, the average age has gone up by 2 years, as has the average age of hospitalizations. Meaning the average age of a new case is now 40 years old, and the average age of a new hospitalization is 68. So the average age of death has remained constant. Looking at our hospital system, we now have 1,324 people hospitalized for COVID-19 across the state. That's roughly a third of what it was in April when we were at our worst point. But things, as you can see, are steadily going up across all these measures, including ICU and intubation. ICUs were actually about a quarter of what we were at our highest point, and intubation's about a sixth, if that helps any. So testing has definitely slowed down due to the holiday 2 weeks ago. We were looking at 1.92 days as the turnaround time on a COVID-19 test, and now it's gone up to 2.1. So that is definitely a big slowdown there. Now that might also just be counting in the backlog when there just wasn't really any testing being done over the Thanksgiving weekend. So we'll see in the coming days if this increases due to increased tests or if this decreases due to catching up. This is a change of about 4 hours longer overall. So looking at our contact tracing, this is where you can see the real effect of that Thanksgiving break there. So you can see the top row here is where things stood 2 weeks ago. And below that is where things stand now overall. As you can see, we've had a huge drop off in the percentage of cases we've outreached. when you look at the 2-week periods here, this is the first half of November, this is the second half of November. There's just been a massive drop off there. And if you look at the dates, this actually doesn't even include too much after Thanksgiving. This is only about 2 days there. Contact outreach is staying not dropping off too much, but it's also important to measure that the less contact tracing we do, the fewer contacts we get. So there's less work to do if this left side is not keeping up there. But the outreach is still saying around 65% being done within a day. But again, as the testing time takes more time to go through, that's also going to slow that down as well there. So looking at the counties where things are spreading, last week we were just around over 20 new cases per day across the state per 100,000 people. Now it's jumped up to 35.7 new cases per 100,000 people per day in the last 2 weeks. There's been a lot of sharp increases. Berkshire County and Barnstable County basically doubled their incidence rate since before Thanksgiving 2 weeks ago. And there's been increases across the state. The only places that have seen any downturns are Suffolk County, came down a little bit, but that is probably due to reduced testing as their percent positivity still went up. And Dukes County did actually go down, and that may actually be an actual downturn there due to lowered percent positivity there as well, which makes sense because on islands, if cases start going up, they're probably going to run through a segmented population like that, but then it will also probably quickly burn itself out. So speaking of percent positivity, this is where things stood 2 weeks ago with a statewide percentage of 3.05. And then we jump over now to this week and we see 3.73. So that's a pretty huge jump right there. We can see where that concentration in Barnstable lead to that uptick in the Berkshires there. Still also big trends in Hampshire County here along the Rhode Island border and along the New Hampshire border are still areas that are getting very high percentage of positive tests coming back. So when we look at this as a chart here, we can see how the last couple of weeks our percent positivity has steadily increased. And the orange line is what would happen if we took out the tests we're doing in colleges and universities, because those are screening tests and thus generally driving the overall average is lower. So we could be seeing a much higher amount here, higher amount than we are really taking into account at the moment. Speaking of higher education, so this is also a thing to know about is last couple of weeks that the number of tests in colleges have dropped down. Thanksgiving break is probably a big reason for that. So that's going to be leading to a higher percent positivity across the state because we're not doing those screening tests as much. Just generally, we're not doing as much tests. So you can see how it used to be, almost half the tests we're running in the state, and now it's a much smaller fraction there. And here's how it looks in terms of the tests coming back positive. Those light blue are the colleges, and those were increasing, even though they were not really anything related to the state as a whole. And here is where things stood last week in terms of testing in colleges, with almost 700 new cases reported at the end of the Thanksgiving week, with 230,000 tests reported. However, when we look at this week, we can see everything has dropped off there. There's only 480 new cases reported. However, there's about half as many tests conducted. So that's something to really be aware of there. So just looking at our 7-day average here, you can see where we have that dip from Thanksgiving and then have spiked back up. Now, these are 7-day averages, so they're a little less volatile than individual case days, but you can see we're kind of still on a trend here from where we were. So that should probably show you where we are about now, and next week we'll maybe start to see what the actual effect of Thanksgiving gatherings and travel was. Next week, when we have more data, we'll also be able to look at the counties more in depth again and see how things are trending. One last thought before we go into the weekend. Here are two mysterious monoliths that were discovered recently. The one on the right was discovered first in the Utah desert, and no one's quite sure how long it's been there. So there's some thought that maybe it was put there decades ago by an artist who put up installation style art like that. No one's quite sure. It was also recently dismantled kind of semi-mysteriously by some people who were trying to claim they're trying to preserve the desert's ecosystems by getting rid of something that was going to attract a lot of people to it. But then this one on the left appeared in Romania recently, and we may see a trend of this kind of art project coming up. So it's just a cool thing to think about over the weekend and do a little research on yourself. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.